And it is time for the spotlight. And who's in the spotlight today? It's the Ministry of Health. We have with us Dr. Osafo Fraser, who is the County Medical Officer of Health for St. George East. And we're just going to be talking about vaccinations. And are they safe? Are you concerned? Well, I'm sure Dr. Fraser will answer all of that for us and so much more. So let's just say good morning to you, Dr. Fraser, and welcome to the Now Morning Show here on TTT.
Natalie, and to all your listeners and viewers.
Thank you so much for joining us. So, welcome to the No Morning Show. I always say when you're on the No Morning Show, you reach.
Okay.
All right, so that definitely broke the ice. So, Dr. Fraser, we're talking about vaccination and whether or not the vaccines are safe. I know that some people have raised concerns about the fact that these are vaccines for emergency use. So let's just start there. When a vaccine is approved for emergency use, how safe is that vaccine?
Right. So emergency use essentially means that we have looked at all aspects of the vaccine. And in this case, we're talking about the WHO, the World Health Organization. And the World Health Organization will look for two main things in the initial instance, which is this vaccine safe? If we give it to people, can we trust that it will not cause adverse effects that are so terrible that people will end up dying in large numbers, terrible side effects? So that's the first thing. And then, of course, they want to know, will this vaccine actually do what we want it to do, which is, in this case, stop the coronavirus and stop them from getting sick. So those are the things they look at, even for emergency use. Once those two questions can be answered, but then yes, they will license it for emergency use, and that's exactly what it is. It's for an emergency situation.
Right.
Full vaccination will come down the line when we can prove, well, this vaccine works, but it works for this length of time. And when we know exactly for how long the immunity will last, well, then full vaccination and full approval will be given at that stage. But the issue of its safety and if it works, that question is answered already before you even consider giving for emergency use.
Right. And yet we still see people raising, concerns about that. So what do you say to those people, who are still raising concerns about, we see the unions are saying, okay, not supporting the government's vaccination drive or not endorsing it because, we're using vaccines for emergency use. But we are in the midst of a pandemic. We are in something new and therefore had to find something to treat with the situation. So it should be enough. Not so?
Yeah, well, and I think we have a lot of experience with emergency use in other parts of the world. And the example I'm going to draw here is the example of the Ebola outbreak that took place in Africa. We don't hear a lot about that outbreak because there was a very successful vaccination program that was done in the Ebola crisis, and that was emergency use. And the emergency use does not mean that the vaccine is still being tested to see if it can work. No, we've already done the trials. The trials would have been the same trials you would have done if the vaccine was going to be approved in 2 years or 3 years. Those same trials have been done and they are finished. What we are doing now is checking to see other things. How long will this vaccine work? Things like, so those are things that it's out there already. We've already done the trials. Right now, what we're doing is observing how the vaccine works once it's being deployed in the real world, which is the same process you will go through whether the vaccine was made in 2 years or 3 years or 4 years. So that's not really true to say that we are using a vaccine that is not safe nor effective.
Right. And the thing is that we're not doing something that, the rest of the world isn't doing. We are seeing these vaccines used right across the world, regardless of whether it's considered a rich country, a poor country. It's the same vaccines that have WHO approval that we're seeing being used right across the world.
Correct. And people are using it to great effect. And the experience we have, because we started a little behind the richer countries, but a lot of the richer countries have shown us through their vaccination program that these vaccines work, and they work in large groups of people.
Right. And not only that, let us get into the individual vaccines. one of the vaccines that we have here that we're using the most, the one that we have the most of, is the Sinopharm vaccine. And let's talk a little bit about that, because we are being told that there are studies that have been done coming out of Australia that suggest that the Sinopharm vaccine is very effective against the variants that we're seeing coming out of this COVID-19 virus.
Yeah, that's true. We're learning a lot more about these vaccines, and we had data was a little short on the impact of the Sinopharm vaccine in particular on a lot of the variants, and the one that we were really interested in was the Delta variant. But we are getting a lot more data, and yes, you're right. There is recent data that shows that the Sinopharm vaccine is very effective against the variants, and especially against the Delta variant. And it's showing that it has the ability to decrease people's chances of going into hospital and dying almost better than the original virus that it was created for.
Yeah. So definitely. So we are in a good position because Trinidad and Tobago has over about 1.1 million Sinopharm vaccines here. I think it's about that.
Yeah, yes, and I mean it's not just Sinopharm. I mean, we're talking about Sinopharm, but people have also got AstraZeneca.
Yeah.
But we had the news about AstraZeneca before. We already knew from the studies that were coming out that AstraZeneca was 90-something% effective against the Delta variant in preventing hospitalizations and death. And so we had already had that news about AstraZeneca. Next one we needed to get news about was Sinopharm, and we got that news. And so we're really very happy.
Right. So then let's talk about who should be vaccinated. I remember that when the Sinopharm vaccine was just approved by the WHO, that Trinidad and Tobago, they took a decision to hold off a bit before, allowing it to be used on pregnant women. So let's talk about, the categories of people who should be vaccinated. If somebody has pre-existing conditions, age, what are the requirements for vaccination?
Well, the WHO, in its recommendation about the vaccines, they will list a list of do's and don'ts, and those who should get it and those who should not. And in their listing, they do not have any recommendation that says if you have a pre-existing condition, you should not have the Sinopharm vaccine. They list pregnant women, and they list people who have had severe allergic reactions to vaccines in the past. Those are the people that they are cautioning the use in, but we are also giving it to everyone else. If you have a pre-existing condition, if you are breastfeeding, regardless, the vaccine is recommended for you. I think our minister has gone publicly on record and said to people that if you have a pre-existing condition and you're a little concerned, check in with your doctor.
Yeah.
But strictly speaking, as far as the WHO recommendation is, there is no condition like hypertension or diabetes or asthma that prevents you from getting the vaccine.
Right. So in terms of categories of people, as of now, everybody here can be vaccinated once they're over 18 and, not pregnant.
Correct. That's correct. Over 18, not pregnant, you are eligible for the vaccine.
And where can we get these vaccines? Because just in case, for some strange reason, somebody doesn't know, how do we access these vaccines?
Well, right now, the mass vaccination program is really taking place all over Trinidad and Tobago. There are a number of drive-throughs taking place. I know that there's one that started up very recently in Wallafield.
Yeah.
And you have all of your health centers across the east-west corridor and in south. Some places you can actually just go online and make an appointment. So I know South has that system in place. In the east, you can check in with your health centers and you can actually go and make an appointment in the health centers. And then the drive-through in Wallafield is fantastic. Jump in your car. I think there are 4 persons to a car. And I've heard the CEO of the NCRHA, Mr. Thomas, say, take a road trip, which I found was really, very nice. You go drive up to Wallafield and you get your vaccines quite easily. So it's available across Trinidad and Tobago at your health centers. Check in with your health centers and you'll get some information on exactly how to access.
Right, that's correct. And over, I think it's 109 health centers, you can do that. You have these mass vaccination sites, that with the government, partnering with the public sector. You have the drive-throughs. So I think that there are so many different ways that people can access the vaccines. They shouldn't have a reason to say, okay, I can't get vaccinated. And we saw Trinidad and Tobago. I can't remember who did the polling, so to speak, but Trinidad and Tobago being ranked as 6th in the world in terms of having the most amount of vaccines administered in one day. And I think that is definitely something to be celebrated, because it means that each day we're improving on the amount of vaccines we're administering.
Yes, I think so. And a lot of kudos to those people who have come out and volunteered in the program. Our healthcare workers have been stellar from the start, but a lot of other people have joined the bandwagon and are putting their shoulders to the wheel and really making this effort successful. And there is some vaccine hesitancy, but we are seeing a lot of people come out and show interest in getting the vaccine. So that's really, really very good.
Right. I don't think at this point, the hesitancy, for those who are hesitant, as you say, check in with your healthcare provider, have that conversation so that whatever doubts you have can be cleared up, because the WHO has approved the vaccine. Everybody else is using the vaccine. We are seeing the benefits of the vaccine, where we are seeing people vaccinated that even if they contract COVID-19, let's talk about that, because people are saying, well, you take the vaccine and you're still contracting COVID-19. Let's talk about how someone is when he or she has contracted COVID-19 after being administered the vaccine. What kind of condition that person might be in.
Yeah, so a lot of the vaccines in their recommendation, they talk about the effectiveness or the efficacy of the vaccine against symptomatic infection and against the ability to go into hospital or against death. And that is exactly what we're seeing. Those people who get infected with the vaccine, they do have a milder course of the infection. And a lot of them, the infection, the time of your symptoms is shortened, the severity of the symptoms is shortened. And the hospitalization and death is something that we're not seeing taking place at all, really, in persons who take the vaccine. So you still can get infected, but it's a much milder disease. You're not severely ill, and certainly you're prevented from dying. So those are the big, big benefits of getting the vaccine.
Right. And I hope people remember that, because, sometimes the fear monger and it'd be like, oh, you're still going to catch COVID-19. There's nothing to prevent you from, contracting COVID-19. What we're saying is don't die. And you'll be less sick. So, and I think those are two very important message that should be, driven across to the public, that even if you get infected, if you're vaccinated, is that the chances of you dying are extremely slim, and that the chances of you being hospitalized are extremely slim, and the chances of you having a very bad form of the disease are extremely slim as well.
Yes, and Natalie, I would say that is no different from how a lot of the other vaccines work.
Yeah.
The reason we don't feel the impact of the infections from other vaccines is because we already have our immunity built up through vaccination. So when the virus from the other infections come upon us, our bodies respond very quickly. It's not that we can't get the infection, but the infection is dealt with very swiftly by our immunity that's already built up. So the vaccines for COVID-19 work exactly the same way.
Right. All right, Dr. Fraser, final words before we wrap.
Well, we know vaccines save lives. And I think Trinidad and Tobago is fortunate in that we have a lot of vaccines available. So whatever your hesitancy, ask a specific question and get it answered. And if you can get that question answered, please go and get vaccinated. It really will save your life, and it can potentially save the life of your loved ones.
I agree with you. And remember, there are mass vaccination sites. There are drive-through vaccination sites. You can get vaccines through your health center. So there are various ways that you can access the vaccines. Dr. Fraser, I want to thank you so much for sharing with us this morning.
Thank you very much, Natalie.
You're most welcome. Dr. Osafo Fraser there speaking to us. Listen, you can get the vaccine anyway. And you say, if you even have any questions, go and get those questions answered.
Carried it. Yeah.
Right.
Exactly.
Simple. Simple as that. get those questions answered and go get vaccinated, all right? We take a break and we'll be back with you.
Love is life and life.